Saludos y bienvenidos a esta.
Greetings and welcome to this press briefing by the Pan American Health Organization on the COVID-19 pandemic in the Americas on this Tuesday, March 23rd, 2021. My name is Sebastián Olial with the Communications Department at PAHO, and this session, as every previous week, will be between 45 minutes and 1 hour long, and we will be accepting your questions up to the end. We have already received your questions via email, and you can also ask your questions live using the Q&A button at the bottom of the screen. Please do include your name and communication or media outlet. Let me remind you that we have simultaneous interpretation into English, Spanish, Portuguese, and French, and please click on the interpretation button. Today, the director of PAHO, Dr. Carissa Etienne, will be reporting on the current COVID-19 situation and will also update you on vaccination in the Americas, among other issues. Today, together with Dr. Carissa Etienne, we have Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Director of Health Emergencies with PAHO, and Dr. Sylvain Aldiguieri, Incident Manager with PAHO for COVID-19. I would like to invite Dr. Etienne to share her remarks with us. Dr. Etienne.
Good morning, and thank you for joining today's briefing. This past week, over 1.2 million people became sick with COVID-19 in the Americas, and more than 31,272 people died because of the virus. More cases were reported in the region last week than the week before, which means that despite the gradual rollout of vaccines, millions of people remain at risk of illness and death. We must continue to take COVID-19 seriously. Cases have started to plateau across the US, Canada, and Mexico, although the state of Ontario in Canada reported a rise in cases in the past 2 weeks. Over the same time period, the United States in the United States, the states of Minnesota and West Virginia have reported increases in deaths. In Central America, we are encouraged by the decline in cases in Panama, which have been dropping consistently for several weeks. On the other hand, we are concerned by a rise in cases and hospitalizations in Guatemala that is straining hospital bed capacity due to the influx of patients. The virus continues to surge dangerously across Brazil. Cases and deaths are increasing, and ICU bed occupancy is very high in many states. It is critical for all Brazilians to adopt the preventive measures that were being put in place to slow transmission of the virus. It can save your life and the lives of those closest to you. Unfortunately, the dire situation in Brazil is also affecting neighboring countries. Cases have risen in Venezuela, particularly in the states of Bolivar and Amazonas, which border Brazil. A rise in cases has been reported in the Pando department in Bolivia, and ICU bed occupancy remains very high in Loreto, Peru. In the Southern Cone, cases continue to spike in Chile, Paraguay, and Uruguay. In Paraguay, a majority of the ICU beds are occupied, and the health system is buckling under the pressure. Uruguay has reported more than 1,000 cases per day several times in the past few weeks, which is alarming given the size of the country. In the Caribbean, a majority of cases were reported by Jamaica, where they have risen steadily for several weeks. Cuba is also reporting an increase in cases. along with Aruba, Curacao, and Antigua and Barbuda. What I've just described is an active public health emergency. The COVID-19 virus is not receding, nor is the pandemic starting to go away. Vaccines are coming, but they are still several months away for most people in our region. Until they arrive, and until most of the population is vaccinated, we must continue to do what works. Wear a mask, maintain your distance, avoid large gatherings, and follow the guidance of your local health authorities. And this is especially important with holidays coming up in many countries. People cannot and must not let down their guard by engaging in close contact with others. Let me provide you with vaccine supply update. As the virus surges and hospitalizations rise, we urgently need to scale up vaccination among our most vulnerable populations. I am pleased to report that 33 of our 35 member states have started immunizations, and over 155 million doses have been delivered in our region thus far. PAHO is working closely with Haiti and Cuba, the two countries that have not yet started, to help them get there. The COVAX facility has delivered 2,161,800 doses to the region so far, which includes more than 1 million doses that were delivered to Brazil this past Sunday. We expect over 100,000 doses to be delivered to various countries this week, and 1.2 million additional doses have already been procured. Although scale-up has begun, we know it is not enough. We do not yet have the vaccines that we need to protect everyone. And this is what happens when the whole world must rely on too few manufacturers. We must also find ways to share vaccines more equitably among countries. The doses that were delivered are helping us start to protect health workers and other vulnerable communities. And we expect more doses to arrive every week. We are also hearing that acceptance of the COVID vaccine has been high, which is very good news. These WHO-approved vaccines are safe and they work. When it's your turn, please don't hesitate. Get vaccinated. Once our supply increases, there is no other region in the world better prepared to deliver vaccines swiftly and safely. The Americas have a long tradition of innovation in vaccines and well-established immunization systems. And this comes from decades fighting diseases like polio, measles, flu, and yellow fever, among others. Our health workers have special expertise driving large-scale vaccination campaigns that cover diverse geographies. This includes campaigns to immunize adults against infectious diseases and not just children. And this is critical in the time of COVID-19. Our region-wide immunization network is the backbone of our primary healthcare system, which enables us to reach more people and to maintain high rates of vaccination coverage. Over the past year, the pandemic forced us to enhance our immunization systems even further. And PAHO has been providing training and technical support to countries so that they have a greater capacity to track adverse events, which will be critical as new vaccines are developed and introduced into the region. We are also helping countries collaborate more closely. They are sharing lessons, information, and innovative strategies to reach more people with the care they need. All of this enabled our region to keep vaccination rates relatively stable during the pandemic. There was a dip last year during the first surge of the virus, but coverage has rebounded. And this is a remarkable achievement and a credit to countries for making vaccination a priority and to health workers for their commitment to keeping our region safe. We must keep it up, both to roll out COVID vaccines rapidly and to protect us from other vaccine-preventable diseases. More than a year into the pandemic, the bravery and resilience of our health workers continues to amaze me. It takes courage to fight a terrifying new virus, and it takes dedication to care for patients affected by the other diseases that are present in our region and were present long before COVID arrived. And tuberculosis is one of those diseases. Tomorrow is World TB Day, and it is a time to reflect on the devastating toll that TB still exacts on the world and how unacceptable it is for people to suffer and die from something preventable and curable. Our region is home to 5 countries with high burdens of tuberculosis, and services in these countries and others where TB is prevalent have suffered during the pandemic. We need to do better. We need to screen more people so they can be treated and cured. We need to uphold our commitments to reduce the burden of TB in our region and around the world. If there is one thing that I hope we take from this pandemic, it is an appreciation for the power of health and the extent to which good health is central to the well-being of societies. I hope that when we call attention to a disease like TB, which has torn families apart for generations, that we listen with newfound urgency and understanding. I hope that we recognize that health for all is not an empty phrase, but the best choice available to us. You see, the power of health diminishes when it is a privilege of the few and not the many. Equal access to good health, that should be our focus. That's how we end TB, and that's how we beat COVID-19.
Muchas gracias, doctora.
Thank you very much, Dr. Etienne. We are now going to move on to the questions that we have received. Please remember that you can also send your questions through the Q&A button. We have received many. Please include your name and media outlet so that we can coordinate with you. The first question that we have received is from Akuneta Anderson from B News Daily, and it is in English.
If most people are not immunized, do we remain under semi-lockdown? Dr. Etienne?
Thank you for this interesting question, Akuneta. Vaccines will take some time.
Gracias por...
And it has been spoken and estimated that countries have to vaccinate more than 70% of their population to control the transmission of COVID-19 and attain herd immunity. In the meantime, however, countries must continue to maintain strict public health measures to avoid transmission. We cannot stress this sufficiently. We are a very long way from reaching beyond that 70% mark. Some countries in our region have received 0 doses of vaccines through COVAX thus far. Other countries are getting enough to vaccinate 2 to 3% of their populations. Although we expect that every country in Latin America and the Caribbean will receive some vaccines in early April, those deployments of doses are not, and I stretch, not enough to protect vulnerable groups. So this makes it imperative that rich countries with surplus doses of vaccines, that they share their doses with countries that have received few vaccines through donations to COVAX or by other means. Vaccine production must be urgently expanded so that sufficient, safe, and effective doses are available to all countries, rich and poor alike. Equitable distribution of vaccines throughout the Americas, we are the region that is the hardest hit by COVID-19, is crucial to combat the transmission of the virus everywhere. Until we get more than 70% of our populations vaccinated, we must continue the smart, effective, and targeted public health measures. You will hear us repeat this over and over again. To make these measures easy to remember, we urge people to avoid the 3 C's. Avoid closed places with poor ventilation, avoid crowded places with many people nearby, avoid close contact settings, such as close range conversations. We must endeavor to practice the public health measures like wearing of masks, frequent hand washing, and social distancing, and the covering of our sneeze or cough. And I want again to urge governments to ensure good public health practice and to be cautious about lifting restrictions, because we could see new increases in cases and hospitalization. So we need to continue the course. Do not let our guards down. Thank you.
Gracias, doctora Etienne. La siguiente
Thank you,
pregunta,
Dr. Etienne.
Alonso González
The next question is by Judith Alonso Gonzalve from Latin America, and the question is, what is COVAX's role in the region? What have been the main achievements of their coverage, and also what are the largest challenges ahead? Dr. Barbosa, thank you. Thank you very much for this question. It is very important. In the region, COVAX is a facility that is trying to guarantee equal access. The revolving fund that PAHO has, and with more than 40 years of experience in the purchasing of vaccines for all of the countries in Latin America and the Caribbean, is the vaccine acquisition mechanism on behalf of COVAX for Latin America and the Caribbean. It is important to indicate that on a positive note, as our director has just mentioned, COVAX started to purchase vaccines and deliver them. 11 countries have already received vaccines. Others will be receiving by the end of this week. All of the countries will be receiving their first supply by the first week of April. These are limited quantities. This is the largest challenge. These are limited quantities that need to be used in a smart fashion based on the national plans, giving priority to the most vulnerable groups, because clearly the first delivery is for a vaccine that has to be used to protect the most vulnerable population and also to save lives. It is also important to guarantee greater access. The revolving fund is in contact daily with all of the producers. It is very important to enhance the capability to deliver vaccines so that the countries can have faster access to the vaccines. The revolving fund is working on this, and I think that in spite of all the difficulties that some producers have had, there are some other geopolitical difficulties in terms of the delivery of vaccines by some manufacturers. The facility is starting to supply the vaccines, and the countries in the region some countries will be receiving the vaccines without the need to pay for them, because it is important, because these are countries that will have access to the first vaccines in spite of their lack of ability to pay. So the amounts are very limited and they will continue to be limited for some months from now. So we need to maintain all of the public health measures and also to attempt to have more equitable access to vaccines. Thank you. Thank you, doctor. The next question is by Kaylin Romero from El Confidencial in Nicaragua, and she's asking whether PAHO has a parameter to consider that a pandemic has already been controlled. What incidents a year would we need to have to say that a pandemic has been controlled? Thank you very much for this question by our colleagues from Nicaragua. In that question, we have several aspects depending on the disease. This is a generic question on epidemiology. I am going to use some examples and then I am going to refer to COVID. In Central America, since we are referring to Nicaragua and in the area of epidemic diseases, the health authorities for now 3 decades have focused on dengue and malaria control. It is important to mention that those diseases do not have vaccines yet. For those diseases, the surveillance departments base their epidemiological surveillance in an endemic channel by using historical data based on a period in the past. Also, the objectives are different in the case of dengue, that is transmitted by a mosquito. The idea is to decrease mortality, and this is a proper clinical management. In the case of malaria, which is intended to be eliminated in several Latin and Central American countries, the threshold of fatality has to be quite low, but also control is important, for example, among pregnant women. As to COVID-19, which I imagine is the focus of this question by our colleague from El Confidencial. Regarding COVID-19, it is important to say that we still do not have accurate knowledge of the pattern of this disease that has become familiar for only a year now. So we do not have that historic perspective, and the various vaccines against COVID-19 are starting to be administered to priority groups, and from what we have learned, any relaxing of the measures in a couple of weeks may have a very strong impact on health systems. Within this context, it is common sense to prepare for an epidemic transmission pattern of COVID-19 that in the mid or long term could become an epidemic, respiratory epidemic, such as the flu and other diseases that have already been controlled. I hope I have addressed the questions by the colleague from El Confidencial. Thank you, doctor. The next questions are similar, and they are by Matias from El Español, Mr. Collins from Guatemala, and saying, given the current transmission status in Latin America, is there any specific recommendation in connection with travels during Holy Week? And Daniel Collins is asking what would be the situation for Guatemala, taking into account that they are facing a third wave and also close to Holy Week and a relaxation of the measures. Dr. Ugarte, thank you, Matias, Daniel, Sebastian, for these questions. I am going to start with Guatemala to be able to refer to the issue of Holy Week. In Guatemala, the latest report indicated that there would be 10,000 active cases based on estimations and a cumulative incidence of about 1% in the population. That is, there is a large number of the population that has not been infected. Over the last 2 weeks, we have seen a relative significant surge in the number of cases, and the probability is at about 15%. That surge has been seen in Retaloe, Quetzaltenango, Suchitepeques, Totonicapán, and Tiquimula. So that surge in cases, mainly in the southeastern area of Guatemala, may be related to flexibilization of the physical distancing measures, the inappropriate use of the masks. We have also seen that there has been a reopening of schools and also an increased movement of individuals among departments, in particular because of recreation purposes. And for that reason, the areas that are mostly affected are those areas that have received more tourists, and we have also seen a very significant increase in the number of cases in some of those areas. So taking this situation in Guatemala that could be closely related to the situation in many countries in Central America, Holy Week is a high priority. It is necessary to constantly implement the measures mentioned by the director, Dr. Jarvis, Dr. Aldiguieri, and all of those who are linked to controlling the pandemic and the disease in the countries, social distancing, proper use of the masks, disinfecting hands, and also avoiding areas with gatherings, large gatherings. Reduce travel to essential travel and only travel if you are healthy during Holy Week, and maintain individual and collective protection measures during the trip and also during the stay at destination. Health authorities are observing the behavior and the transmission of the virus in the area to be able to adjust social distancing measures among other public health measures, and at the same time to prepare health systems to make sure that there is enough staff as well as supplies, as well as hospital beds and ICU beds if necessary. Let's remember that Holy Week should be a spiritual period, and let's have Holy Week not a week like the ones we've had before during Carnival, Christmas, New Year's, where we have seen a very significant increase in the number of cases with more deaths and people affected by the disease in many countries. As the director has just mentioned, we are in the transmission mode and we do not have sufficient protection to be able to have more relaxed measures. To that end, I wish you all a very special Holy Week, protecting yourselves and also protecting your family and members of the community. Thank you. Thank you, Doctor. The next question is by Parla Marcos from La Nación in Argentina. She's asking, why are vaccination vaccines so unequal in South America, and why have we seen a surge in the number of cases in South America? Dr. Barbosa. Thank you. Thank you for the question. I think that both aspects are very related. First, there is inequality in the access for the countries. Unfortunately, this is not only in Latin America, but in the world, because many countries had more conditions. They have better conditions to establish bilateral agreements since they are high-income countries. The COVAX mechanism is equally distributing vaccines among the countries. So Gavi, WHO established an experts committee that is using an algorithm to try the list of countries. And for example, for those countries, for the first rollout, all of the countries are receiving about 2.2, the equivalent of 2.2% of their population. There may be a problem with the first rollout, but that is the average for all of the countries. Now, the countries that have bilateral agreements are receiving the vaccines that they have purchased. This surge could be increasing with letting our guard down. It is difficult to maintain people's attention. We know that over a year of the pandemic, people are tired, and also the impact on the economy is quite high, as well as the social impact. But it is very important to highlight that if we do not maintain all of the measures that work to diminish the speed of transmission, and also if we let our guard down, and if we think that we are going to have an immediate impact on transmission due to the vaccine, this is not true. We are going to have a case surge. You are going to see that even in countries where vaccination started in January, such as some European countries, some of those countries had to implement very strict measures, even a lockdown, such as France and Germany. In spite of the vaccine, they needed to implement those measures to diminish the rate of transmission. The US has reached a very important mark with 6 million individuals vaccinated. After 9 weeks with a very strong decline, we had an increase in cases. So we need to maintain those measures in a very significant fashion in all of the countries. In every country, the authorities have the ability to monitor each region each day to be the reality until we are able to control the pandemic. Thank you. Thank you, Doctor. We have several questions that are linked to Brazil. In English, the first one is by Michael Stott from Latin American editor of Financial Times.
Brazil seeing such an aggressive spike in the number of coronavirus deaths and cases now. Do you believe this is due to the new Manaus variant, or are there other reasons? Y Anthony Boal de Reuters News en inglés, también vinculado con Brasil, pregunta, should neighboring countries in South America take measures to prevent the spread of Brazil's contagious variant of coronavirus? If so, what should they do? Should neighbors tighten border restrictions? How serious is the risk to them? Dr. Aldieri?
Thank you for this series of big questions from Reuters and Financial Times. So regarding the situation in Brazil, we as PAHO are using the monitoring of the information provided by the authorities of Brazil at federal and state level. We had detected spikes in transmissions 2 weeks after the Christmas holidays and 2 weeks after the carnival period. So this is also, there is a huge component in terms of movement of population. And during the last weeks, we can say that the transmission of SARS-CoV-2 in Brazil is high or very high and increasing at the same time in all regions of Brazil, the north, the center, the northeast, the southeast, and the south. This is the difference compared to the 2020 wave, the increase at the same time in all regions of the country. According to reports from the federal level, as of yesterday, 22 March, 26 of the 27 federal units, states and the federal district, reported a stress on their ICUs. And in 23 of these 27 federal units, they have reported more than 85% occupancy of their ICU beds. Now, regarding the variant of concern called P1, and what was initially detected by the Brazilian scientists in the state of Amazonas, late 2020, this P1 variant of concern is now reported to PAHO through the regional genomic surveillance network in 15 countries and territories of South America, North America, and the Caribbean. So it's quite a widespread at the regional level. So as PAHO has clearly stated during many press conferences, The strict implementation of public health measures, guided by the epidemiological indicators, will be crucial to control this increasing transmission. These measures should be implemented and monitored by all levels of administration, including the state and the municipal level. These public health measures work on variant of concerns also. However, the risk of new surge exists already in the countries of the region, even with the circulation of a wild type as during 2020, especially in countries of the Southern Cone. The spread of a Piran variant of concern would add one more layer of complexity on the response of the health systems. So again, the main message of PAHO in this context of surge in Brazil, of surge in some countries of the Southern Cone, is that public health measures, when strictly implemented, work against the variants also. I hope I have answered the concern of the journalist, of both journalists.
Sí, doctor, gracias. Y solo una
Thank you. And just one follow-up question in connection with Brazil. This is from Reuters.
To find suppliers that could sell Brazil the intubation drugs needed for serious cases of COVID-19 that are running out in the overwhelmed hospital system. Dr. Alighieri.
Thank you for this second question. For 20 years plus, PAHO has established a strategic fund mechanism for procurement of strategic goods for supporting the ministries of health and the response to outbreaks. During 2020, in the context of the first wave, PAHO has assisted Brazil in procuring, through this mechanism, some of the medications used in ICUs. For the current situation, PAHO is ready to assist Brazil with the procurement of intubation drugs and other strategic goods as antigen-based rapid diagnosis tests and other items related to oxygen supply chain. So we are ready to assist Brazil. Thank you.
Gracias, doctor. Siguiente pregunta.
Thank you, doctor. The next question is by Gisela Salomon from AP. I would like to give the floor to Gisela to ask her question. Hi, thank you, Sebastian. I have two questions. One, in connection with Gavi today announced that they are strengthening the COVAX vaccines for areas with the purpose of humanitarian assistance. I am asking whether this includes the Americas and whether you have information as to what areas of the Americas could benefit from this reinforcement. For example, if the area of Colombia bordering with Venezuela could receive this, for example, in the case of the Venezuelan migrants, or the area of the US border with Mexico. And second, you have said that there has been an increase of cases, in some cases in South America, such as in Paraguay and Uruguay. Is the situation in Paraguay and Uruguay a situation of concern for you? For example, in Uruguay, the experts have requested to limit the mobilization or the movement of people, and in Paraguay there have been manifestations against this, and there has been a request for impeachment of the president. Could you refer to this and also to the legal impediment? Dr. Ugarte, thank you, Gisela. Your questions are very proper in terms of the vaccine supply within a humanitarian context. From the inception of the COVAX facility, 5% of the vaccines were expected to be maintained for allocation in humanitarian contexts in those areas where individuals do not have access to health services, to vaccines, and who could be at greater risk, not only greater risk of infection, but also greater risk of transmitting the disease to areas of mobilization. In this regard, the decision announced by Gavi is in line with this thinking, and this is a coordinated effort between UNICEF, WHO, Gavi, and others to be able to purchase those vaccines and distribute them in areas with large flows of migrants and areas that have higher concentration in the countries, in particular for those who are not part of the health services or who are not part of the national immunization plans. This is a specific country by country analysis. Other areas of the world have serious humanitarian conflicts, and it is highly likely that these vaccines be used in other areas. But in our region, some areas clearly show that migrants have greater risk to become sick because they are in temporary campgrounds where the level of transmission may be very high, and also that transmission may have an impact on those countries that are already affected on a longer basis, and this includes Venezuela, Colombia, and also the population in Haiti, the Dominican Republic, the border that you mentioned between Mexico and the US, and other areas with high flows of migrants. These are areas that need to be analyzed to benefit from this vaccine pool. 5%, up to 5% of all the vaccines globally. It is not much. Therefore, it is highly necessary to underscore that migrants in the countries should, because of epidemiological reasons, to be able to reduce transmission in the country itself, those migrants should be part of the vaccination plans based on the priorities established by the country for their own nationals. This is a benefit for the country itself and also clearly for migrants. As to the increase in the number of cases in Paraguay and Uruguay, I have already said this and also answered this in connection with Guatemala. We are concerned due to the surge in many countries. We are concerned because of the relaxation of the social distancing measures, among others. We're also concerned because people have a heightened sense of security now, and they feel it is time to loosen the measures. And what those increases are showing us is that we have not reached the stage in which we can benefit from a loosening of these measures. Quite the contrary, they are going to end up with the mass closing, curfews in several places and for longer periods when, as a matter of fact, those measures that could be implemented could avoid these cases. I would also like to highlight that the conflicts that we see, such as the one that you mentioned in Paraguay, are also seen in other countries. In these times, these are the times when we need to show cohesion and solidarity among all of us to introduce, to add the scientific population, the population groups in the preparation and decision-making processes is a very healthy, proper measure, transparent measure that will make the population more trustworthy of the authorities and the measures they are implementing. We hope this is a path to a solution in Paraguay and in other countries. Thank you. Thank you, Doctor. Now I would like to give the floor to Douglas McIntosh from Jamaica Information Service. Douglas.
Good morning. My question relates to the Cuba's vaccine development. Could you give us an update on how far along that has progressed? In terms of the clinical trials, when are these likely to be completed? Is there any consideration at this stage to including that vaccine in the COVAX basket of vaccines. Are there any concerns arising regarding that development? And if it is being considered, when is it likely that it could become available for distribution to countries? And sorry, and there's another question. Is there any other regional country that is engaged in any similar vaccine development? Thanks.
Thank you, Douglas. Doctor Barbosa, ¿podría contestar?
Dr. Barbosa, may you address the question?
This question. Of course, that it's very important that we have vaccines being developed in Latin America and the Caribbean. We are aware that at least in Cuba and in Brazil, they are developing vaccines. These vaccines are in early stages, some of them, clinical trials, phase 1 and 2. And it is very important that also we stress that there is an unprecedented effort in the world. We have around 200 projects to develop new vaccines against COVID-19. More than 60 are now in clinical trials. The Cuban vaccines started the clinical trial phase 3 last week. That's the information that we have. We are facilitating the communication of all developments with the pre-qualification WHO team in Geneva, so they are aware about all the criteria that they will have to meet before asking for a pre-qualification. I mention this because the revolving fund can only purchase a vaccine that is pre-qualified or have an emergency use listing from WHO. So Cuba, the most advanced vaccine that they have, started very recently, last week, the phase 3 clinical trial. So they will probably have, it's not easy to establish the data that they will finish a clinical trial because it depends if they are testing the vaccine in a country that has a low, a medium, or a high rate of transmission. So it can take 3 months, 4 months, 6 months. But when they finish the clinical trial, and based on the results that they will have about the security and the efficacy, they can apply to receive the pre-qualification or the emergency use listing. And after this, this vaccine can be considered to be purchased by the revolving fund on behalf of COVAX. So COVAX facility. So we welcome all the developments of vaccine in Latin America and the Caribbean, but all vaccines in the world to be purchased by the COVAX mechanism, they need to achieve the same criteria to ensure quality, safety, and efficacy. Thank you.
Gracias, doctor. La próxima pregunta es
Thank you,
de...
doctor. The next question is by Blanca Valadez from Millennium in Mexico. She's saying that specialists are warning about the importance of accelerating the vaccine given the surge of a new variants that has no vaccines approved. How much is this of a reality, and has PAHO been watching this? Dr. Aldigueri. Thank you, Sebastian. Thank you to my colleague from Millennium. PAHO is also insisting on accelerating vaccination immunization campaigns in the region. The sustained transmission of the virus may lead to the emergence of new variants because a higher number of sick individuals may give more opportunity to SARS-CoV-2 to mutate at this point in time. And also, as we have seen in other opportunities during this press conference, it is important to recall and also to say that the implementation of strict public health measures is efficacious against these vaccines and also contributes to lowering the risk. As to treatment, I would like to mention that the standard medical protocols have improved significantly over the last year, and they are being updated as we await solid evidence from clinical trials. As to the surveillance of variants, PAHO, starting in 2020, has been coordinating a regional genomic surveillance network for SARS-CoV-2, and they have provided support to the countries in the Americas to strengthen their ability to monitor the variants of concern. And we have a regional snapshot on a weekly basis at the regional and sub-regional levels. Last week, we knew that 32 countries had detected at least one of the three variants of concern globally. One of the main goals we have is to enhance this genomic surveillance network with new authorized labs so that they can have the technical capability through funds and training in person to learn how to sequence the virus, and also in particular in specific regions and large countries. And I would also like to underscore that we are activating all of the scientific cooperation mechanisms in the region among the countries to monitor those changes, those genomic changes regarding SARS-CoV-2, and also to be prepared with the development of new treatments, response mechanisms, and also next generation vaccines. I hope I have addressed the question by our colleague from Milenio. Thank you. Thank you, doctor. We have several questions from journalists in connection with Venezuela. This is from Variana Confec, Efecto Concuyo, also from Alegría Noticias, and Antonio Delgado from Miami Herald. They say Venezuela finally agreed to free resources to pay participation in COVAX. Do you know what the first vaccine will be to be received by Venezuela? What are the payments to be made by Venezuela after the first payment of 18 million? And once Venezuela receives the vaccines, is there concern in connection with the logistical aspects, given that the country has problems with fuel supply and also power supply? Dr. Ugarte, thank you for the question. Indeed, the efforts among the political actors in Venezuela, the Ministry of Health, the Scientific Society, the Academy of Medicine, and several other actors have allowed to get to this situation and the decision to free up resources to have access to COVAX. This is the first step. The payment of 18 million to have access to the COVAX facility is a measure that is underway. The vaccines that are expected are the ones produced by AstraZeneca. They are produced in South Korea. They are not the vaccines that have shown any adverse reactions as clarified by the European authorities and WHO. After the first payment, it is necessary to ratify that there are enough funds, about $6 million, to complete the rest of the vaccines. And that is about 2.4 million vaccines, and they would be arriving upon payment and upon allocation of the vaccines in the next round of vaccine allocation for the countries. To that end, the internal mechanisms in Venezuela to increase vaccination are quite advanced. Venezuela is implementing vaccination with the vaccines at hand from other sources, Sputnik and Sinopharm. Therefore, those measures or that implementation of the vaccination have also shown that there is a need to strengthen the cold chain, the logistical aspects, training, and access to essential services such as fuel, transportation, electricity, water, and other elements. And all of that is part of the common efforts to be made by everyone as to when this mechanism will continue. We are here urging for a continuation of this joint work because the well-being health of the Venezuelan population is at stake here, and it is very important to continue with these efforts. I think that the public health sector and the government have shown that it is possible to make progress, and we are optimistic that this will come to fruition. Thank you. Thank you, doctor. The next question is by Katia Rojas Toro from Destino Panama. She's saying, how complicated will it be to reach herd immunity, taking into account other factors such as the low availability of vaccines and the emergence of new variants, and also the lack of strict observance to the measures and the fact that we do not know how long the immunity will last? Do you foresee another year of pandemic and even more? Dr. Barbosa, thank you. Thank you very much for the question. To reach herd immunity will be a challenge. And you have already mentioned some of the limitations we have. First, in connection with vaccine availability, it will continue to be limited for some months, and there could be variants that could diminish the efficacy of the vaccines. That is another argument to work in coordination, but also in a very active fashion to reduce transmission. The more the virus is transmitted, the higher the possibility to have new variants that could change the behavior of the virus. Therefore, that's going to be, we don't know. We don't know the level of vaccination, in the population that is needed to have that herd immunity. Some refer to 70% of the population, others are referring to 80%. Even if we take into account the most optimistic 70% value, that is going to be a challenge. You need to remember that there are not currently enough vaccines authorized for children and youth, adolescents. We are talking about a very high coverage among adults. That's the reason why we need to have more vaccines. It is necessary to have direct communication, transparent communication regarding the safety of the vaccines so that we can avoid vaccine hesitancy so that some groups have no access to the vaccines. That is going to be a challenge, and we need to work with all of the countries on all of these aspects in connection with the vaccine from the point of view of communication and support for them to have more access. But until we reach herd immunity, as the director already mentioned, and as our colleagues already mentioned, there are effective measures to prevent transmission. Those measures cannot be looped in any of the countries. It has to continue until we reach herd immunity. And I think that a highly likely possibility is for countries that can obtain both tools for control, that is to say, public health measures that are effective and vaccination. Those countries will be the ones to first reach control of transmission. We need to maintain both pillars. We need to coordinate. We cannot let our guard down. We cannot give rise to false expectations that the vaccine will have an impact within a week or within a month. Thank you.
Muchas gracias, doctor. Ahora sí estamos llegando al final de esta sesión.
Thank you very much, Doctor. We are reaching the end of this session. We have several questions in our chat in connection with the arrival of the vaccines to the various countries. I am going to read in English some of these questions. For example, Ms. Alvarado from Trinidad and Tobago, another question from Bahamas, and a question from Vera Rodriguez from Radio Gran Rosario.
Each country will get their vaccine shipments from COVAX. If Dr. Etienne can you provide an update on the timeline for countries receiving COVAX vaccine in the region? Thank you, Dr. Etienne.
Thank you, Sebastian, and thank you for that question. I know this is a preoccupation of many countries in our region. I want to assure you that PAHO is doing all that it can to accelerate access to vaccines in our region. Following PAHO's negotiations with the COVAX partners, we have ensured that 21 countries in the Americas will receive their first deployment of vaccines by the end of this week. And in early April, all countries in our region will be able to receive their first deployment of vaccine. This is good news. But supply is limited, and the amounts deployed represents in many and most cases a small percentage of the country's populations. So despite some progress, our region has been and remains the epicenter of COVID-19 pandemic, with many countries reporting high mortality. We all know that vaccines are our way out of the pandemic, but only if we have more equitable access to vaccines to cover more than 70% of our adult population. As a region, we need to work together and to explore different mechanisms to expand the pool of vaccines available. If the supply is limited and if rich countries are buying it off, then that limits our possibility of getting adequate vaccines. And PAHO will continue to play a coordination role to make this happen. But we need to count on the solidarity of our member states. We must explore all options together. We need to seek donations by countries who will have surplus vaccines. We need to be able to share vaccines through loans of vaccines, and this is not new in the region of the Americas. We need to work together to expand manufacturing capacity in the region. And we need to continue to work with manufacturers to supply vaccines at prices that will enable equitable distribution within and among countries. The world needs to ensure that in a pandemic of this magnitude, that vaccines are being able to be produced in the quantities that we require. And they must take the decisions at a global level that allows this to happen. You know, we've overcome many health crises since PAHO was founded nearly 120 years ago. And in all of them, we have counted on the expertise, the resources, and the solidarity of countries within our region. This is a hallmark of this region, the solidarity. So with this unprecedented health crisis, we need to put our best minds and hearts together so that we can expand supply and coverage for all countries, and thus ensure that those who need the vaccine are able to access it. You know, the health of our populations and the strength of our economies depend on this. So let's work together to make it happen. Thank you for being here with us today.
Muchas gracias, doctora Etienne. Ahora sí, entonces.
Thank you, Dr. Etienne. We have now reached the end of today's session. We'd like to share with you. I will show this in the chat. We will also show you a dashboard where you can find information on the vaccines, the countries with the numbers of vaccines delivered in the region, and the vaccines through the COVAX facility and the revolving fund. There you can see the information to date. And let me remind you that you can continue in contact with us through the email and also obtain more information on PAHO's website, www.paho.org. Greetings, and we will keep in contact.